Now, it's been labelled a party drug that gives people license to practice unsafe sex. For others, it's a vital part of the fight against HIV. I'm talking about Truvada, a pill said to be 90% effective in preventing HIV infection when taken daily. Well, now the U.S. Centers for Disease Control and Prevention has updated its clinical guidelines, saying that the pill should be taken by all those who are at risk of HIV. For reaction, we're joined now by Jim Pickett of the AIDS Foundation of Chicago. Welcome to Newsday.
Good morning. Thank you for having me.
Thank you. Now, the pill came out in 2012. Why do you think so few doctors have prescribed it?
Well, I think it takes a long time for new innovations to diffuse. We saw it take well over a decade for oral contraception to roll out into the 50s and 60s, and we still are having issues with that at times. Any new technology, even if you look at internet uptake in the United States, we're not at 100%. So anything that's new takes a while to diffuse. We're only 2 years into this, into having Truvada as a proven preventative. And so I think we're actually doing okay. We do not need to wring our hands too much about being too slow.
Well, you mentioned the issue of prevention using condoms and other means. Now we're talking about Truvada. The head of the U.S. AIDS Healthcare Foundation called it a party drug, which gives people a license to practice unsafe sex. What do you say to that?
I think his comments are absolutely ridiculous, and they are not founded in science. The science is very clear that when taken as directed, Truvada as prevention could provide upwards of 90% protection. Truvada requires people to take a pill every day and to see a doctor 4 times a year for HIV and STD screenings and other monitoring. This is hardly reckless or irresponsible behavior or something that akin to a party drug.
But does that mean they don't need to use condoms anymore?
Well, I think what we need to be clear about is lots of people already aren't using condoms, and that's why we have nearly 2 million new infections on the planet every year. Condoms have met their match. For people who continue to use condoms, that's great. We continue to reinforce that. But there's lots of people who chose long ago to stop using condoms, and that's why we need new technologies like Truvada as PrEP.
And so if taken, you are saying that people can more or less not worry about being infected?
If they take it daily, yes, we have seen in all the studies, people who have blood levels that indicate daily dosing, they're at extremely low risk of HIV. I wouldn't say zero risk, but upwards of 90%. After all, nothing in life is 100% risk-free. The only absolutely 100% risk-free way to prevent HIV through sex is to not have sex.
But that's the difficulty, isn't it? People would wonder if they are the 0.0%. It's difficult. It's a
certainly,
tough
but
call.
most of us, we walk outside the door every day, and we get on trains and buses. We hop on planes. We leave our homes, and we encounter hundreds and hundreds of risks. Living is a risk behavior.
Thank you very much indeed. On that note, Jim Pickett of the AIDS Foundation of Chicago, thanks for joining us on BBC Newsday.